The next area I'd like us to start discussing is stigmatization. Stigmatization simply means the creation of or application of stigma or social stigma. A stigma is a strong social disapproval of behaviors and thoughts that are considered to be contrary to perceived social norms. And of course, this means that stigmatization assumes that there is a consistent definition of normal or of norms. So stigmatization simply means these are the times when people are being judged or rejected as a result of preconceptions that may be out there in society. We're going to start to explore stigma in a little bit more detail, but before that, I'd like you to take a moment and answer the following 3 questions in your journal. I'm going to give you about 8 minutes to do this, but I'd like you to spend about half of that time on the last question in particular. If you have a partner, as always, we want you to discuss what you wrote after you're done or review the online blog. The first question, what are some common views of mentally ill or addicted people? Think about what you read in the newspaper, talk about in social circumstances, or here at work. How are those views created or spread? What's their origin? And this is the question I want you to spend about half your time on. What impact do these stigmas have on people with mental illness or addictions? And I'm hoping you'll come up with some concrete impacts, not just what do they sort of do to people morally speaking, but what actual impacts might they have on a person's quality of life in a specific way. We're also going to ask you to do a second piece of exercise work before you come back to the video. You'll notice if you go on the Moodle platform that there are links to a number of different articles and columns. I'd like you to work on your own or with a partner to review a selection of the articles and columns presented. Do at least 4, and if you feel like you can do all of them, then look at all of them. Using your journal, answer the following, and this is going to take you a few minutes. What impact might the pieces have on public perceptions of mental health? And what I mean here is, do you think they might be informative? Do you think they might lead people to have misinformation? Do you think they might not simply catch any implications to mental health at all? Is the impact likely to be subtle or strong? In some cases, the articles will appear to you not to have anything to do with mental illness whatsoever. And in some cases, in at least one case, you'll have to read through the entire article to find just one reference that might have an impact on social stigma. What elements of the article are likely to influence the reader? I want you to take this hint. Think about elements that go beyond the language and the specific choice of content. Those are certainly valuable and important, but look at some of the other things that are made, the choices that are made by the media in terms of how that article or column is presented. And we'll talk further about that after you've had a chance to do this exercise. As always, if you're using the online blog, put your thoughts there so that others can review them later on.